Again, welcome back to Studio Daybreak Africa. If you just tuned in, reaching in from Studio San Ondo City, of course, I'm me, Ezekiel. Okay, this morning we'll be talking on a pressing health issue, and it's going to be Alzheimer. It is known as the progressive disease that destroys memory and other important mental functions, brain cell connections, and the cells themselves degenerate and die, eventually destroying memory and other important mental functions. Now, more than 1.5 million cases per year in Nigeria. I guess it's quite a topic to talk about at this point. Alzheimer's disease is a brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. And with us to do justice to this topic is Dr. in the house, Dr. ORITOKE OKEOWO. Welcome on Daybreak Africa, man.
Good morning, doctor. How are you doing today?
Thank you. Good morning. How are you doing, sir?
I'm doing very good.
Thank you for having me.
You're welcome.
So right now, away from my statistics, what can you tell us to be this disease exactly, and how important, should I use the word important, or how prevalent it has been so far in our society?
Yes, I would say that Alzheimer's, first of all, is a form of what we call dementia, and dementia is what we say memory loss. So Alzheimer is a form of it. There are other forms of dementia, but Alzheimer is the most common form of dementia, and it's very prevalent. Although we have the early onsets, those that can come up with this disorder earlier than 60 years of age, and then we have the late onset, which is the most common one, where we have a lot of people who on the aged group come up with it. But we're saying that so when it comes to the prevalence, it actually has been on an increase so much, and of course, if we relate it, we will notice that when we can, it's of prevalence that you go out and then you hear that a woman was found walking around and she had lost her way, or a grown man had lost his way. He can't remember the name of his child or his son, things like that. And there was an article that I saw which said that there has been an increase of over 400,000 over a 20-year period, even in Nigeria. And it says that there's about 63,000 plus of patients with Alzheimer's disease in 1995, and as of 2015, there is about 318,000 patients, and this is exactly over 400% increase between 1995 and 2015. So over the last 2 decades, there has been an offshoot of patients who have come down with the disorder.
All right. Now you made mention of 2 set of people talking about, but most of them look like just adults. Now my question is there an age range for people that do suffer? Can we also see this in younger children, especially children from age 5 to, let's say, 10, or is just particularly for the adults alone?
Yes, Alzheimer's disease is particularly for the adult. It's an adult disease. Although it is not a normal form of aging, it is a disease condition in aging. So you definitely have only people from around 60 to 60.
Okay.
Alzheimer's is basically we'll call it a neurodegenerative disorder, meaning that you have the neurons degenerating, and this happens at the older age before this comes into play.
All right. It is said that the level of one neurotransmitter, acetylcholine, are particularly low in the brain of people with Alzheimer's disease. Over the time, different areas of brain shrink. Does this brain produces this type of neuron transmitters themselves, or they are kind of things that we need to eat or be on, or kind of let me say medications that we need to be on for these neurotransmitters to be active?
Okay, so basically, if you want to go into the science of it, we would say that neurotransmitters, yes, acetylcholine is a neurotransmitter, and it is one of the major neurotransmitters that have been implicated in Alzheimer's disease. Also, it's not only acetylcholine. It's a neurotransmitter that have been identified. There are other things now that research has recently found out to be implicated in Alzheimer's disease. So we have things like what we call tau protein. So we call them, they're a form of debris that goes around or that accumulate around in the brain. So basically, if I want to explain it to a layman, I would say that when I ask a young student, a biology student, that what is this basic unit of life, they will tell me it is the cell.
course.
But when I ask, what is the basic unit of the brain, of the nervous system, we call it neurons. And that's what we call nerve cells. So when we have the cells in the regular other parts of the body, in the brain, the kind of cell that you have is called the nerve cell or the neuron. So these nerve cells look a little different from the regular cells that we have because they look more like trees. So when I want you to picture a tree in your brain, so in form of a tree, you have like a circle, you have the tree, like the stalk, the one that goes down from the root upwards, you have the root, then you have the area of the tree where you begin to have the branches come out. So when you have those branches, we call those areas the dendrites. Okay, so when you look at a tree that has so many branches, what you find out is these branches, as they grow, they get to meet each other over. I don't know if you get, like there's this circle, they get to meet. There's this cross section, like there's an interconnection between all of the leaves and the branches, one way or the other. I'm looking at a big tree, and that's exactly what happens in our brain. So these nerve cells and their dendrites are what we use for communications. So that's what it looks like under the microscope. So when we look at our brains, typically under a microscope, these are the kind of things that we get to see. So now this set of let's say tree-like branches, this set of branches from the tree, that we call dendrites, can be affected by different things. Of course, a very old tree, what do you think? After a while, what happens? They begin to fall off, right?
Of course.
They break off. So where you have the two ends of the branches or two sides of the branches touching, what will happen? They can no longer touch, right? I'm trying to relate it very, very simply. The same thing is happening in our brain. Right. So if you have a very strong wind blow and it cuts off or it eats that part of the tree, what's going to happen? You're going to have the tree losing communication or feeding at that end of that tree. That's what happens in our brain. So as a growing, like I said, the disease of the age, so we call it neurodegeneration. So as you age, you begin to lose some of these connections naturally because now you're aging. But of course, if the person has had some lifestyle issues or some kind of trauma, some kind of things that have happened in the life, some environmental factors, some genetic factors that has led to those communication loss, then of course, that patient will be more prone to lack of communication as compared to someone who is not prone, who has not been exposed to such conditions.
In your words, I heard you talk about genetics.
Memory, you can have, like that would say, most what we would readily see is somebody being forgetful. They cannot recollect faces, recollect names. And I'm sure there are a lot of movies who have tried to depict this. So you have a father who you've known all your life, and now your father can no longer remember your name. And the father can no longer remember your face, asking you who you are. So I do not think that Alzheimer's in itself can lead to stroke. Alzheimer's in itself, no.
All right. Now I still have this question. I want to know this Alzheimer's disease on its own. How does it affect the behavior of an individual, especially when they have to interact with the general public and also people that they've known all their life? And should in case they get hit with this disease, how is it possible for them to regain themselves back?
Okay, so one of the major things that we talk about is lifestyle changes. So of course, a person who has begun to develop Alzheimer's disease, one of the most things that you would find around, like I said, loss of memory, and again, another one is confusion. So the person is naturally confused because they're trying to connect the dots or in their brain. Who is this? Why not this person from? So they are naturally in that confused state. So basically, more of what they will need around is support and love. If possible, things that can help to strengthen those connections. For example, we'll talk about exercises. Either it can exercise, they have love. So that means now they are forgotten, but you're there or somebody is around or people are around to remind them, oh, this is called a cat. It's called a baby. This is a baby. This is your child. This is your son. oh, my name is so I'm your son. Do you remember the last time that we went to when I was 5 years old? You used to tell me that this, you used to tell me that. You're trying to help them reconnect the dots because naturally they've lost some connections in between. So, but you know, with practice, over and over time, you can, as the people around them, we get to show them a lot of love. They try not to let them, help them not to keep forgetting or to keep remembering. And of course, we get to give them medications. So when you say Alzheimer's, like you also mentioned acetylcholine. Acetylcholine is a neurotransmitter. And so if I want to teach now, and I'll try to describe what we call the synapse. And I say at the level of the synapse, so if you've lost, so it could be, so we said there's neurodegeneration. So that means that the patient has probably lost more of the neurons that are producing acetylcholine, or acetylcholine is no longer available, or there are not enough receptors to pick on acetylcholine that we call cholinergic receptors, where these neurotransmitters would act to produce the effect of connection. So basically in pharmacology, then we begin to look at the treatment options. You want to increase the amount of the neurotransmitters, or you want to ensure that when neurotransmitter is available, you do not have the natural substances that would clean them up, because there's a way we are naturally wired in our physiology, which is our normal state. So you want to try to degrade or reduce the amount of those enzymes present in our brain to mop up this acetylcholine so that it's available for this patient to use. So it's like you need fuel, but something mops up your fuel. Let's say there's a towel around. So I want to remove the towel so that when the fuel is available, I need it to spread on that floor. But when there's a towel, the towel can soak up this fuel. So I remove the towel so that when the fuel is available, it has the ground for itself to work, and it can interact with the floor. So I'm just trying to use it. So in that way, we give different medications at different points, make the neurotransmitter available, reduce the amount of enzymes that mop these neurotransmitters up, so the patient has enough of those neurotransmitters, or then increase whatever can help give generation of the receptors, so there's more use of the neurotransmitters, and in that way the patient can gain connection. If there is no pickup, then there is no connection. These neurotransmitters are needed for that interconnection. So if there is no pickup, there is no connection, and the patient will not be able to get the remembrance, to connect the dots. And so those are like the treatment option. But of course, majorly lifestyle changes are extremely important. Anything to keep them active. You know, the more you use, the better the person will be at. So I know there are some puzzles that they give in abroad teaching hospitals. They have some kind of games that they get to keep around them, so that they have continuous brain activity. In that way, they are stimulating their brain to constantly keep in touch. Not like when nobody is there, no, they're not doing anything. So those brain puzzles help their brain connections over time. So by the time they begin to talk to people, there is activity. So the brain is being in constant use, and in that way, most of those patients have been reported to feel better, or to get better, to better recover from Alzheimer's.
In the long run, you need to see it's a disease that has no cure.
Yes, for now, there is no cure for Alzheimer's. There are a lot of drugs in clinical trial. Of course, different amount of grants and funding is put into research to try to, to find the cure. Of course, the aim is to find the cure. But even before you find the cure, you need to find the underlying problems. So initially, we had the neurotransmitter acetylcholine being pointed out as the main problem, the main cause. But now, like I said, there are other information. There are fibrillary tangles that has been reported. There is tau protein that is being reported that say they are forming debris. So that means like debris, like dirt, clogging in between these interconnections. So now these research fundings and grants have been able to find out all of this. So now the researchers are doing their best to find out what is going on. We found out this. So what can we do? What can we do to the brain to remove this debris so that if you can remove these tau proteins, this tangling, if you remove them, then of course we can find relief for these patients. But of course, research is ongoing. But at the moment, what I know is that there is no cure yet. Research is ongoing, and as much as possible, there are more findings and more things to update almost every day, especially about Alzheimer's. Even in Nigeria, I know a lab in Yola that one of my senior colleagues had just gotten grants for, and their major focus is on Alzheimer's. And I'm sure that in the next few years, they will be able to give us an update, something new about what is going on too.
And on that, I tend to wonder, do we have more like, I say, a preventive drug, something to actually keep on beat?
I didn't get that, please.
Do we really have a preventive drug for it? Or maybe
Preventive.
yes, a vaccine or something.
There is no vaccine, no vaccine, no preventive drug. So that's why we would say lifestyle changes. So lifestyle changes in more activity, be more active, and then people would also say go for early tests, early diagnosis. Let's say if you have those genetic genes that have been found out, so you can do testing to know if you have any of those genes that could predispose you to early onset of dementia or Alzheimer's. So I think basically those are the things that are still available for now, but there is no vaccine.
As time memory loss, do you have any other symptoms we actually pinpoint? Because in Nigeria, basically we tend to relate memory loss to just being old. You're old, so it's okay to have memory loss in Nigeria. We don't really detect or have to figure out if it's Alzheimer or any form of dementia at all. So is there any other symptoms we could actually possibly pinpoint?
Could you come again, please? I lost you in between.
Okay. I was asking them, is there any other symptom to this disease aside memory loss?
Memory loss is the top one, and of course, like I said, there can be confusion. You would find sometimes difficulty in speaking, understanding, and difficulty in expressing your thoughts or their emotions. Getting lost around. Sometimes you have some people who, they say you have trouble. You could have troubles handling money or paying bills. Some people ask a lot of questions, like repeated questioning. Then you can have people taking time to complete their regular or daily tasks. Losing balance and problems with some kind of movement. Sometimes it looks like there could be hallucinations or experiencing delusions or paranoia. Some people could lose interest in their daily activities. But of course, these things are not far-fetched. If I know you before, or if you're my son, or I know that I know this thing, and now I can no longer recognize, what do you think would happen? I definitely would feel somehow about it. So I might not want to communicate more. I might just want to keep to myself because I know that I might not be able to remember this thing. So these people are actually going through a lot of psychological disturbances. So you would expect that they might want to keep to themselves a lot more, and they just want to ensure that they are not, maybe if they don't have caring people around and they shout at them for saying, how come you cannot remember this? How did you get lost? Yesterday we picked you up. Today again we picked you up. The next time, what do you think? They naturally will not want to express themselves. So, and in this part of the world, as compared to in the developed world, where we see everything as what's wrong with you, what's wrong with you. No one particularly is, saying that this could be a clinical problem. Can we, nobody wants to really spend money going to the hospital. They are just like, you have grown old, just sit at home. Why are you going around? Not understanding that these people were once young. They moved around, they enjoyed moving around, they know places, they know things. And in their old age, keeping them to sit at home is not their best option. So they also want to try, they want to move around. But of course, along the way, they could lose a connection, maybe they miss a junction, and the next thing is they begin to wonder, and people are like, what's going on? We found your mommy here, we found your dad here, and the children are feeling like, what's going on? How can you make people be calling me? I begin to look for you. So it's a lot in between, but I feel like there is more to us, and probably when we have more data, communicate out more information, more data, then people can understand, and then encourage people to use hospital facilities when they see this kind of symptoms, and create avenue for them to get help. And that's why we have homes in the developed world, home for the aged, so that even when you think you cannot take care of them, they are in this setting where these people understand their peculiarities, and so they take care of them very well.
All right. You made mention of researches that are still going on, but I want to know, from what we've gotten so far, are there any kind of nutrition that can boost this when on the way for recovery, nutrition or physical exercise or things that needs to be done that can really help them on their way to recovery?
Yes, of course. We would, like I mentioned, lifestyle changes, and lifestyle changes include much more movement, brain activity. I mentioned puzzles, games, even if it's irregular IU, those things that make you count 1, 2, 3, 2, 3, 4, 5, 6. If you have younger children around them, that would make them recite things, even if it's things like listening to radio, things that make them just, have some kind of, they want to question or they want to give an answer. So even if a person cannot be sitting down around them, you keep them in an environment, ensure that the TV is on, there's brain activity constantly. They are constantly open to brain activity. And of course, every form of food that can enhance brain activity, of course, we'll say balanced diet. You don't want to keep any kind of food that would be detrimental to their natural health. Also remember that they are not getting younger, they are old already. So you want to give them food that can easily digest so that their body is not weak, they are strengthened, and food that can increase regular activities. So then you want to give supplements. We have different supplements for different age groups. So supplements for their age group would also help them to increase their brain activity.
All right. There's something I want to really talk about. I'm going to cite a scenario that happened. There was a lady, a very young lady, that she had a very good memory and everything was fine. And she, on the course of trying to meet someone, she fell and she hit her head. And immediately she fainted, she passed out. When she woke up, she couldn't remember anybody. She couldn't even know who was her roommate. That was it. It happened back in school. And she was returned to the hospital. She was taken to the hospital, and after, let me say, some 6 hours, she was able to recollect back. Now, I want to know the relationship between this Alzheimer and, let me say, shock, then sharp hit on the head or any part of the nervous system of our body. Is there any relationship with this?
Like I mentioned again, Alzheimer's disease particularly is a disease of the old. If a person has trauma to the brain, we have brain regions that are responsible for memory consolidation, keeping of memory. So when a person has a fall and that particular brain region is it. So it's like you have a phone and your phone falls or your laptop falls. What do you think? Immediately it could go off for a while. Some of the phones would connect back, like they come back. Some would never. So there could be amnesia. Amnesia is like forgetfulness, loss of memory, but short one. So at that point, the lady in question, I think, had amnesia due to the trauma. And over time, with some time and rest and some medication, she's able to. So it's like there's a kind of reset. She had a trauma. So it's the trauma that caused the loss that she had at that point. But thank God it wasn't more than that. Some people never regain their memory from that kind of trauma or something a little more than that. But in that way, Alzheimer's is, let's continue. Alzheimer's, remember that Alzheimer's is neurodegeneration. The neurons have degenerated. It's a disease of the old. But having amnesia, that can happen. Amnesia can happen. It could be trauma induced, and it could just be maybe another kind of so let's say something else. It could be accident, trauma induced, or it could be in the form of a disease. If you have a part of the part of your brain responsible for your memory consolidation, if the part of the brain gets damaged, then of course the person will definitely lose the memory. But that's beyond, or that goes beyond. That's not Alzheimer's. In Alzheimer's, we have neurodegeneration, and it's a disease of the old, because it's only when you get older you begin to lose, or you have your neurons degenerate.
You also made mention of the debris that forms in the brain and the rest part of it, and also the acetylcholine that also causes this issue. Now, my question is this, I'm kind of curious. What are the reasons why we have this debris? Do they just form due to activities or lack of kind of, maybe say, vitamins in the body? How do they just come together and form and start causing chaos in the mind?
Okay, so of course, when you have a new baby, when you have a new child, a baby, their systems are still forming, and a lot of things are going. They're building up things, different part of the body, and things are still fresh and new. Just like your how do you explain when you buy a new shirt and after use, it begins to change color. It's not looking as sharp as when you initially bought it. It's out of use. So we're constantly using our brains, we're constantly using our body system, just like every other organ would not be as functional as when we were youth or when we were children. When we were children, it was growing, forming. When it gets to a stage, it's already well formed and in giving us the best. And as it begins to age, it begins to also decline in activity. The brain is also an organ. So the same thing happens. So now in the brain, beyond the nerve cells, we have other kind of cells around the brain. We call them supporting cells, the neuroglial cells, that help in cleaning up. Normally, it's not like these debris don't form, but we have other kind of cells that do form, that do clean up. They phagocyze, they clean up, they clean the surrounding, keep that surrounding clean. If you have a house with trees and you don't have a gardener, then your house will not be neat all the time. But of course, if your gardener is old too, you would not have the efficiency as it used to be. So now, because this gardener is older than that other gardener, or this gardener was it as a professional as the other one, then of course, these are just, that's what we call it, disease of the old. They are naturally happening. Of course, we expect that with good, if the lifestyle growing from young age, old to old age, because we've said that people who regularly exercise, who have good diet and all of that, they have low risk of having these diseases like Alzheimer's. So compared to people who are on poor diet and who have low exercise during their youth, or during as they age. So we're saying that they are more predisposed to Alzheimer's disease, because like there is no activity, or who are not having enough of brain activity as while they're still young. So we say that they could be more predisposed to Alzheimer's disease or any neurodegenerative disorder.
All right. Thank you. We are kind of very much out of time now. So just let's say in 1 minute, what is your last word for the general public on how to be able to live their life and be able to be away from the risk of being in this situation?
Yeah, so to the general public, what I would say is that first, to every individual, we need to embrace good lifestyles, because all of these lifestyle changes or all of this lifestyle modification have good effect or long-term effect on our existence. So while we are still alive, we want to be old and want to be healthy. So as we age, we begin to cut out things that we should cut out, begin to do practice more healthy living as we move forward, engage in brain activities, because we need our brain to generally survive. And also, I would say that to people who are around these old aged people, we should find a way to show them more love and more support, because like we said, it's a problem of it's a disease of the old. We all have let's say it's a 0.1% of going through the same thing. So we should give out the same love and affection, the same way we want to receive if it happens to us. So we should make use of the hospitals, ensure that we take them for evaluation, keep them alive, keep them, keep them working,
Active.
keep them doing something, keep them having activity because they need it so that we too can also get the same when we also grow older and the society can be safe for every one of us.
All right. Thank you very much, Doctor, for coming on the program. We really appreciate you.
Thank you too. Thank you for having me.
All right. I believe we've heard it all from the general public, and you've also heard it from the doctor. When we hear of this, Alzheimer is a disease of the old. So when we see this, we should try to take our old people for checkups, let them go to the hospital. They can be helped there. They will be getting a lot of helpful hands and things will get better. Don't just, let's leave them alone because they are old, according to what Ezekiel said earlier. We should always do our best to make sure that we give them the kind of care that we also want to receive when we get to their stages. And from us here, we'll be calling it a day on Daybreak Africa as we hand over to our Lagos studio, which will give you more juicy package. From here, I remain Michael Obagiri.